Hey, Dr. Mom, if you've ever been told that your child is low in iron and suddenly you spiral into, wait, is this serious? Did I miss something? What do I even do now? This episode is for you. In this episode, we're going to cover three things: why iron deficiency happens in kids, who is the most susceptible, and how to think about treatment from both a conventional and an integrative medicine perspective. Because when you're a doctor, Mom, you get the opportunity to utilize both options. I'm Steph, registered dietitian, mama of two, and author of the Mindset and Metabolism Substack. I'm here to help you feel confident in how you feed your family with nuance and practical tips that work for even the busiest of families. I cannot tell you how many times I've sat across from a mom who says, we just had labs done and they said my child has low iron, and I have no idea where to start. In the US, around 8 to 14%, possibly higher, closer to 20% in newer data, of kids have iron deficiency, meaning they have depleted stores, but they're not quite considered clinically anemic at this point. Then around 1 to 2% do have clinically diagnosed iron deficiency anemia. Lab levels vary by age group, but your doctor will check hemoglobin and ferritin levels to determine the level of deficiency in your child. So know that if you're experiencing a kid with iron deficiency, you're not alone. It's actually common and it's treatable, and we're going to get into what you need to do to take action, starting with reasons why it can happen. So iron deficiency anemia happens when the body doesn't have enough iron to make hemoglobin, which is the protein in red blood cells that carry oxygen all throughout your body. And without enough iron, your kids might feel tired, pale. They might be irritable. They might have headaches or struggle with focus in school. Maybe they're having a hard time sleeping, or they get sick more often than their peers. So who's at the most risk? Well, toddlers who drink excessive cow's milk can be at risk because that cow's milk can crowd out iron-rich foods, it can irritate the gut lining in some individuals, and it can block the absorption of minerals like iron. That calcium and iron do not play nicely together. Those who are at or below poverty level, certain racial and ethnic groups, pickier eaters, right? Those that have limited animal protein intake, rapidly growing kids and teens, teen girls with heavy menstrual cycles, endurance athletes, kids with digestive issues like celiac disease or inflammatory bowel conditions, kids following a vegan or vegetarian diet without intentional planning. And here's something interesting. Iron deficiency develops slowly. It's not dramatic at first. It's fatigue. Why are they so moody? It's difficulty concentrating. It's sometimes considered the silent nutrient gap, right? So first, I want you to know that iron deficiency is not just about a lab level that we're fixing, right? That is just minimizing what's going on. Iron affects immune function, cognitive development, and energy production. And that means we need to really think about it holistically and through multiple approaches. We need to get that lab value up and the body functioning properly while simultaneously addressing underlying causes for why it's even happening in the first place. So let's talk about treatment. And we start with conventional medicine because it matters and is actually very effective. So the standard treatment for iron deficiency anemia and iron deficiency in some cases, if it's low, is oral iron supplementation. And we want to do this at therapeutic doses. When we're talking about therapeutic doses, this is more than just what's in your kid's multivitamin, and it's more than what we can get from food alone. The dosing is going to depend on your child's lab values, so make sure you're working with your child's pediatrician on that individual supplement plan. Unless you're seeing signs of iron, don't just automatically throw iron at your kids. We want to make sure we are giving it to the kids that need it, looking at lab values, and then retesting every 8 to 12 weeks or so, sometimes longer. And that's because labs need to be rechecked to confirm improvement. Do we need to stay at this dose? Do we need to increase the dose? Or are we at a level where we can try to maintain it with food alone? Form matters. So pediatricians often recommend ferrous sulfate, but that recommendation can come with common side effects, things like constipation, dark stools, and nausea. If your kids are already struggling with constipation, this is especially unwanted, right? And when kids feel crummy taking iron, they stop taking it. One of my favorite forms that I use in clinical practice is called iron bisglycinate. It also is called chelated iron. And here's why. It's bound to the amino acid glycine, which makes it gentler on the gut. It's typically better absorbed, and it causes less constipation and nausea. And because it's better tolerated, guess what? Compliance improves. And compliance is everything. For many families, this switch makes all the difference. For the form of iron, if you have little ones who can't swallow capsules, liquid iron supplements or dissolvable tablets or chewables are going to be your best options. For chewables, a lot of the products that I use the form carbonyl iron. That's a bioavailable form, and it's typically gentler on the stomach as well compared to other forms. So let's continue to think practically with this, right? If it's miserable to take, if you're having a fight every time you try to give it to your kid, it won't get taken. This conventional treatment works. It really does. It raises hemoglobin, it restores iron levels, and it prevents developmental consequences that can happen with low iron long term. But here's where integrative thinking comes in, right? If we only give iron and we don't ask why iron was low in the first place, we miss the bigger picture. We also miss opportunities to enhance the overall effectiveness of the treatment. So an integrative approach asks, why did iron get depleted in the first place? Is the dietary intake of iron-rich foods too low? Is absorption impaired? So let's start with the food as medicine foundation, right? The most iron-rich foods are going to be your animal proteins, things like red meat, beef, venison, dark poultry, things like chicken and turkey, organ meats, which I know is so hard to get into kids, but if you shred it into ground meat in small amounts, it's so concentrated, it can make a huge difference and they may never know. Sardines and shellfish, if your kids are interested in, those are also really great sources. You can do things like make mini meatballs, tacos, spaghetti. If you mix up that organ meat into the spaghetti and marinara, your kids may not be able to tell. It can work really well. You can mix these animal proteins into things like mac and cheese that your kids are already loving, or I'm a Midwest girl at heart, so casseroles, right? Veggies, protein, some kind of carb, they'll love it. We know heme iron from animal sources absorbs 2 to 3 times better than non-heme iron from plants. So if your kids don't eat meat, we got to get strategic here, right? We have to be paying attention. We want to do things like pair plant-based iron with vitamin C, berries, citrus, bell peppers, those type of things enhance absorption. So think about maybe like a bean dip with bell peppers, or a snack of pumpkin seeds with strawberries, or spinach mixed into a smoothie with berries. If you're open and willing, if your kid's dealing with iron deficiency anemia, even small amounts of red meat throughout the week can help support the repletion. But even with those iron-rich sources, know that it takes daily servings, right? Daily servings of these foods to meet the growing demands of kids and help with that repletion or continued maintenance over time. And for toddlers, know that drinking a lot of milk can play a role in iron absorption. So we typically cap it at 16 to 20 ounces a day if they are drinking it, unless otherwise directed. Sometimes that can shift the appetite and make them more hungry for iron-rich foods. Now let's talk about gut health, because if a child has chronic constipation, diarrhea, bloating, or known gut conditions, we know that there might be a level of absorption impairment. So things like probiotic support, addressing inflammation, testing for celiac disease or inflammatory bowel conditions is so important, because you can't absorb what your gut can't process. And then we got to think about cycle support in teens, right? If you have a teen girl that has heavy periods, we might need to think about an OBGYN evaluation or a discussion of hormonal regulation options, or really just making sure we are being very mindful about the iron-rich sources. Another option is throwing in the iron fish. So if you're making pasta or if you're making a casserole, there's an iron fish that you can put into what you're cooking, and that will help pull some iron into the food, or cooking with cast iron, right? These are all ways that we can support it. So I have another tip. I want to just finish up with this one because this one's not often talked about. Low iron can look a lot like ADHD symptoms. So inattention, hyperactivity, impulsivity, difficulty with focus and emotional regulation. These are not always ADHD symptoms. They could be symptoms of iron deficiency affecting the brain. And here's why. Iron is essential for the production of dopamine. This is the neurotransmitter that you know that's associated with attention and motivation and impulse control. And when it's low, dopamine synthesis can be impaired. When iron is low, it can be impaired. So when dopamine signaling is off, you get a child that struggles to sit still, right? Wiggles, can't focus, can be emotionally dysregulated and exhausted, but wired. Research has actually found lower iron stores, specifically lower ferritin levels in children with ADHD compared to children without it. And some studies have shown that correcting this iron deficiency can lead to a measurable improvement in ADHD symptoms. So here's my clinical practice rule. If a child comes to me with an ADHD diagnosis or a parent is wondering if their child has it, we need to put that as part of our diagnostic criteria to look at, right? We need to make sure we are making sure that they are getting enough iron while or before we talk about behavioral interventions, medication conversations, and anything else. So here's the good news. Remember, this is something that's fixable. It's not complicated. It's a not pleasant blood draw for your kid. It gets normal and better over time with testing, but it's a blood draw and then the targeted nutrition plan and supplementation. So if you're a mom and your child has been diagnosed with low iron, just know that there's so many different options that are available for you, including food, but also we're getting better about the oral supplementation too and finding flavors and different types of forms that work for kids. So let's recap 3 important things to consider. Iron deficiency is common and it's treatable. Conventional iron therapy is effective and often necessary. Use it, dose it properly, find a form and flavor that your kid likes, and then recheck labs to make sure you know what your next steps look like. Integrative medicine supports the whole child. We want to think about food, gut health, and supplementations as a solution. If you want the full version of this is exactly what we do inside of the Dr. Mom membership. We have specific protocols that help you choose targeted support, general support, and foundational support, so you're not piecing it all together on your own. If you want to join us, head to drmommembership.com or click the link in the description. If this episode helped you feel more grounded about iron in your child's health, please share it with a mom friend who just got that lab call, or a mom who's been wondering about her kid's attention and has never thought to check iron. You can help another Dr. Mom, and you've got this.